Hello and welcome to this video. If this is your first time of coming to this channel, you are welcome. Kindly subscribe to this channel, hit the notification bell and share this video if you found it valuable. In this video, we will debunk 10 common fertility myths to help clear up any misunderstanding and provide accurate information on fertility. Fertility is a complex and important topic, but there are many myths and misconceptions out there that can cause confusion and fear. Let's debunk these myths, shall we? Myth number 1. Fertility declines significantly after the age of 35. This is a common belief, but it is not entirely true. While it is true that fertility does decline with age, the decline is not as serious as many people think. In fact, many women in their late 30s and early 40s are still able to conceive and have healthy pregnancies. The fertility decline that does occur with age is due to a decrease in the number and quality of a woman's eggs. However, this decline is gradual and varies from woman to woman. Some women may experience a more significant decline in fertility at an earlier age, while others may maintain their fertility for longer. It's also important to note that age is just one factor that can affect fertility. Other factors, such as overall health and lifestyle, can also play a role. Therefore, it is not accurate to say that fertility declines significantly for all women after the age of 35. So, the bottom line is that while fertility does decline with age, it's not excessive for all women, and there are many factors that can affect fertility. If you have concerns about your fertility, click the link in the description to book a consultation with our fertility consultant. Myth number 2. Stress can cause infertility. While stress can affect many aspects of our health, there is no conclusive evidence that it can directly cause infertility. Some studies have suggested a link between stress and fertility, but more research is needed to confirm this. It is always a good idea to manage stress, but it is not a guaranteed way to increase fertility. Myth number 3. Certain positions during intercourse are more likely to result in pregnancy. The position of the body during intercourse does not affect the chances of pregnancy. As long as sperm is able to reach the egg, pregnancy is possible. Some people may believe that certain positions can increase the chances of pregnancy, but there is no scientific evidence to support this. Myth number 4. You can't get pregnant while on your period. It is possible to get pregnant at any time during the menstrual cycle, including during your period. The fertility window is usually around the time of ovulation, when an egg is released from the ovaries and is available to be fertilized. However, the exact timing of ovulation can vary from person to person, and it is not always easy to predict. It is also possible to get pregnant if you have irregular periods or if you have recently stopped using birth control. Myth number 5. Birth control pills can cause infertility. Most types of birth control pills are temporal and reversible, meaning that they do not cause long-term fertility problems. After stopping the pill, most people will regain their fertility within a few months. However, there are some rare cases where the pill can cause fertility problems, but this is typically only if the pill is used for a long period of time, like several years or more. Myth number 6. Men do not experience fertility issues. Both men and women can experience fertility problems, and male infertility is actually a factor in about 40% of infertility cases. There are many potential causes of male infertility, including low sperm count, abnormal sperm shape or movement, and problems with the testicles or prostate gland. It is important for both men and women to be aware of the potential causes of fertility problems and to seek medical advice if they are having trouble conceiving. If you are looking for a trusted solution for low sperm count, watery sperm, or zero sperm count, then click the link in the description for our number 1 recommendation. Myth number 7. Certain foods can increase fertility. While it is important to maintain a healthy diet and lifestyle to optimize overall health, there is no scientific evidence that specific foods can increase fertility. It is a common myth that certain foods such as oysters or chocolate can boost fertility. However, there is no scientific proof that these foods have any direct effect on fertility. In fact, A healthy diet and lifestyle are important for overall health, including reproductive health. This means eating a variety of nutrient-rich foods, staying hydrated, getting regular exercise, and managing stress are all important. However, it is also important to note that some foods can have negative impact on fertility. For example, alcohol and tobacco can decrease fertility in both men and women. A diet high in processed and unhealthy foods can also negatively impact fertility. So, while certain foods may not directly increase fertility, maintaining a healthy diet and lifestyle can certainly improve your chances of conceiving. It is always best to speak with a fertility expert for personalized advice on improving fertility and overall health. Click the link in the description to get access to expert fertility consultation. Myth number 8. IVF is the only option for couples experiencing infertility. IVF or in vitro fertilization is a treatment option for infertility that involves fertilizing an egg with sperm in a laboratory dish and then transferring the embryo to the uterus. While IVF can be an effective treatment option for some couples, it is not the only option. There are other treatments available, such as medication to stimulate ovulation or surgery to repair reproductive organs. The right treatment option for a couple will depend on the specific cause of their infertility. Myth number 9. You can't get pregnant if you have an STI. This is not necessarily true. While some STIs such as chlamydia and gonorrhea can cause infertility if left untreated, many people with STIs are still able to get pregnant. The key is to get tested and treated for any STIs as soon as possible. If you have an STI and are trying to conceive, it's important to discuss your options with a healthcare provider. Myth number 10. You can't get pregnant if you have intercourse during menopause. Menopause is the time in a woman's life when her menstrual periods stop and she can no longer get pregnant. However, it is still possible to get pregnant until you have gone 1 full year without a period. The hormonal changes of menopause can cause irregular periods and fluctuations in ovulation, making it difficult to predict when you are most fertile. It is important to use a reliable form of birth control if you do not want to become pregnant. In conclusion, infertility is a complex issue that can have many causes and a variety of treatment options. It's important to remember that both men and women can be affected by infertility and that there are options beyond IVF. If you are struggling with infertility, click the link in the description to discover our time-tested solution to your fertility problems. At Afro Organics Nutrition, your fertility is our concern. If you found this video helpful, go ahead and hit the subscribe button, like the video, share and leave a comment below. See you in the next video.